Are you in your 40s and you're having achy joints, hot flashes, night sweats that come and go? You're more moody, you're more irritable, more anxiety than normal? Well, you may be in perimenopause. And today we're going to talk about perimenopause, what it is, and what you can do about it. That sounds good to you? Continue watching. Well, welcome to my channel. I'm Dr. DuPont. I'm a board certified gynecologic oncologist, and I'm passionate about educating women on how to live longer and healthier lives. And I believe that begins with great health. Well, there's been a lot in the media about menopause. Oprah and Halle Berry have given televised talks about their menopause journey. And so I've had a lot of patients come to the office saying, hey, I was watching Oprah and she was talking about her symptoms of menopause, and I think I have every single symptom. So if you're in that category, keep watching today and we'll kind of go through what are some of the symptoms of perimenopause, how do we define menopause, and then what can you do about your symptoms. So in terms of menopause, now menopause occurs when you've had no cycles for 1 year. So 1 year, no cycles, we say you've gone through the change. This is a normal, natural process, but it can happen early in certain instances. Let's say you had surgery and your ovaries were removed. Well, you'll be in surgical menopause. I've had patients that go into menopause, and that's chemotherapy-induced menopause. Well, radiation can also cause menopause. Some of my patients that are treated for cancer of the cervix may go through menopause when they get their radiation. And so there's other things that'll cause your ovarian reserve or your ovarian function to stop, not just the natural process. Now, we do know that smokers will go through menopause 1 to 2 years earlier than non-smokers, but we do know that the timing of menopause is more related to genetics. So when your mother went through menopause, or your big sister went through menopause, or your aunt went through menopause, it's more likely when you'll go through menopause. You're more like the women in your family than other women, but the average age for American women is 51. So that just means that half the women will be under 51 who go through menopause, half will be over, but that average age is 51. Now, when we're talking about perimenopause, now that may last 4 to 8 years, and peri just means around, so around the time of menopause. So the perimenopausal transition is that time before you go through your last cycle. So the time up until you've had 12 months with no cycles. So once you've had that 12 months, we say you're in menopause. Everything before that is the perimenopause transition. Now that lasts from 4 to 8 years, but we do know in African American women, it can last up to 10 years. I'm not sure why we have it longer than others, but just keep in mind that the symptoms may be around for a while. I have some women that manage it and they don't need anything. Other women are really debilitated and it really affects her quality of life. So for those are the patients that I see, and those are the ones that usually will seek a care of their healthcare provider to get treatment. Now, one of the first symptoms though of perimenopause is abnormal bleeding. So typically you may have irregular timing of your cycles. You may notice that they're coming less often or they're shorter, but a lot of times that change in your menstrual pattern is one of the first signs that you're starting that perimenopausal transition. Now, keep in mind though, during that time too, as you get older, we're also worried about your risk for cancer because it does increase. So if you're having abnormal bleeding, and what that means is bleeding more than 7 days, if you're passing clots where you're having big clumps of tissue come out, or you're changing your pad or tampon every hour, that's too much. So that is abnormal. I've had patients tell me, I'm wearing diapers because my flow is so heavy. So that is abnormal. And so if you're having abnormal bleeding, you definitely want to see your healthcare provider because, we're thinking about, things like uterine hyperplasia, which can be treated with either hormones or surgery, or uterine cancer or cervical cancer. So make sure you get your pap test also if you're having abnormal bleeding, because those are things that we don't want to miss that are easily treated. Now, the anti-Mullerian hormone is a hormone that is a very good marker for reproductive aging. And typically when the serum AMH is undetectable, menopause will occur within 4 to 5 years. And we don't usually check labs unless, you had a hysterectomy and we're not sure when you went through the change or if you're starting to go through the change. But typically we will follow your history, your clinical history, and your bleeding. That's kind of how we kind of tell where you are in this transition. Now, some of the symptoms of perimenopause, they're very common, and I have women tell me this all the time, and I definitely have noticed a pattern over the years. Number one is changes in your menstrual cycle. That'll be the very first sign. Hot flushes and night sweats. Now, when you're in the early phase of perimenopause, you may not have them every night. You may have them every now and then. And so they may not be as noticeable to you because they're not happening as often. Some women will get sleep disturbances where they're just tired. They can't fall asleep. They're not staying asleep, or they're waking up very early. And so that does affect their jobs and their ability to be able to function. Some women will have vaginal dryness. They notice also decreased libido where they're just not interested in intimate activities. They may have depression. I've seen quite a few women that have new onset anxiety where they were never anxious before, but all of a sudden they have just severe anxiety. And so I'm seeing that more often. Patients are telling me they have dry eyes, dry skin, their hair is thinning or shedding or falling out. They may have kind of achy joints. So there's some of the very common symptoms. And then weight gain is a really big one that most women notice. So, weight gain, usually it's weight gain in your midsection or belly fat is what a lot of women have noticed, especially women that have always been thin their whole life. And now they're struggling to maintain the weight that they used to have. They may have more bladder infections, more vaginal infections as they have, a decline in estrogen levels. And then I've had some patients that have headaches that maybe never had headaches before, but all of a sudden they're having headaches. Heart palpitations is another one that I see. It's not as common, but I do hear a lot of patients that have heart palpitations where they didn't have it before. Of course, if you're having those, you need to be seen by a cardiologist just to make sure it's not something else. But I do see that in the perimenopause to menopause transition. And then brain fog. Women are more forgetful. They can't remember things that they always could remember, or they can't kind of remember everything they used to do. So brain fog is very important as well. So there's stages of perimenopause. There's the early perimenopause, there's late perimenopause. Early usually starts in your early 30s to 40s, and that's when you begin to notice that these symptoms are occurring. They're not all the time, they're just kind of occasionally, but as you get through the perimenopause transition, especially towards the late perimenopause, these symptoms may be more persistent and not go away as they were before. You may start to skip your cycles in late perimenopause, and you might start having more of the hot flashes just often and more sleep disturbances more often. Again, menopause will occur when you've gone 12 consecutive months without a cycle. And again, the average age is 51, although it can occur earlier. And what are some of the things that you can do? So definitely exercise, watch your weight. What I tell patients is that really their metabolism is slowing down. So, you'll have a teenage boy who can eat anything and not gain weight. Well, their metabolism is super high. As you age, your metabolism does slow down. So things like, adding strength training and eating more protein, looking at the food you eat, because what you ate in your 20s, you can't eat in your 40s. You'll gain more weight and you just have to eat differently. And so seeing a nutritionist if you can't do it on your own, or talking to your healthcare provider. Reduce your carbohydrates and added sugars. I think as I've gotten older, I think the foods have changed. I remember when, I was in elementary school, we had little kind of bags of chips. They were really small. And now it's like a little bag of chip is like huge. It's like the portions have increased gigantically in the US. So we're eating more, we're eating unhealthy. And so definitely try to cook more at home, exercise more often. I had someone last week that said, I exercise twice a week, and like twice a week is not enough. You really need to exercise 4 to 5 times a week, and you need to add strength training more so than cardio. So definitely increase your physical activity. Drink more water. Water is very important. Definitely drink things that don't have sugar, don't have added sugars. And then reduce your stress. I know that's easier said than done, but try to reduce your stress as much as you can, because some people do gain weight when they're under a lot of stress or a lot of pressure. And then we talked about increasing your protein intake. So who do you see? So menopause.org does have a website where you can go to and find a certified menopause practitioner near you. So it's menopause.org. You can talk to your OBGYN doctor. You can talk to your primary care doctor. There may be menopause specialists in your area that deal with women that are going through menopause, because it's very important that you see the right person so that you can get the right treatment. I also, in researching this for this topic, found a lot of online resources. I knew there were some, but oh my gosh, I found so many. So I'm going to give you a list and put it on the screen. But MIDI Health, Alloy, Winona, Sesame, Plush Care, Effecti, Inner Balance, Evernow, My Menopause RX. So there are a lot of online resources. If you don't have a menopause practitioner in your community or someone that's close by, there are definitely online resources, and I'll put them on the screen, and I'll also put them in the description below so that you can check them out. I don't have a preference. Some of them I just literally just found out about, but I'll put them in the description box below for you to check them out, because there are a lot out there. And then again, definitely check out the menopause.org, their website. I'm a member, I'm a certified menopause practitioner, and they do have great resources. I love the MenoNotes. It'll be MenoNotes, MENO notes. They have really great information on just topics about sleep, about natural therapy, when to, or, should you start hormone replacement therapy. And so they have a lot of great topics that they address, and they're very short, 1 to 2 page sheets that are just great information I give to my patients. So definitely check it out. It's menopause.org. And join me. I'm having a virtual workshop in October, on October 9th. and we're going to talk about perimenopause. So if that's interesting to you, check the link below and I'll put the information so that you can find out how to sign up. Well, I hope you found this helpful. I do have other videos on menopause and perimenopause, and I'll do another video on the menopause period soon. Not quite done with it yet, but I am working on it. So I hope you found that helpful. If there's something that you've tried, some tricks or tips, and you want to share with others, please put them in the comments below. Again, if you have not liked this video, please give me a thumbs up. It helps me with the algorithm. And if you have not subscribed, please subscribe to this video. It helps me to continue making great content for you. And if you have a friend or family member or coworker that you want to share these videos with, please send it to them and encourage them to subscribe. Thank you for watching to the very, very end, and I'll see you in the next one. Bye-bye.